When it comes to contraception, there are many options available, each with its own unique benefits and considerations. One method that has gained increasing popularity over the years is the intrauterine device, commonly known as the IUD. IUDs are small, T-shaped devices that are inserted into the uterus to provide long-term, highly effective birth control. But what exactly are IUDs? How do they work? What are the different types? And what should you consider if you're thinking about getting one? Let's explore everything you need to know about IUDs and why they have become a trusted choice for millions of people around the world. To start, let's examine the basics. An IUD is a small device, usually about the size of a quarter, made from flexible plastic, and sometimes wrapped with a small amount of copper. It's inserted into the uterus by a healthcare professional during a quick in-office procedure. Once in place, an IUD can prevent pregnancy for several years, ranging from 3 to 12 years, depending on the type. There are two main categories of IUDs: hormonal and non-hormonal. Each works in a slightly different way, but both are extremely effective. Hormonal IUDs release a small amount of the hormone progestin, which thickens the cervical mucus, making it much harder for sperm to reach an egg. It can also thin the lining of the uterus, making it less likely for a fertilized egg to implant. Some hormonal IUDs may even stop ovulation in some people, providing yet another layer of protection. Non-hormonal IUDs, on the other hand, are often referred to as copper IUDs. The most well-known brand is Paragard. These IUDs are wrapped with a thin coil of copper wire. Copper is toxic to sperm, so when sperm come in contact with the copper in the uterus, they become immobilized and cannot fertilize an egg. Unlike hormonal options, copper IUDs do not contain any synthetic hormones, which makes them a preferred choice for those who want to avoid hormones altogether. Effectiveness is one of the main reasons why IUDs have become so popular. Both hormonal and copper IUDs are more than 99% effective at preventing pregnancy. That means fewer than 1 out of every 100 people using an IUD will become pregnant each year. This rate of effectiveness rivals or even surpasses that of sterilization procedures, but with the added benefit of being completely reversible. Another advantage of IUDs is their long-lasting nature. Once inserted, there's no need to remember to take a pill every day, use a patch, or schedule regular injections. IUDs can stay in place and provide continuous protection for years. When you're ready to become pregnant, or if you simply want to stop using the device, a healthcare provider can remove the IUD, and fertility usually returns quickly. IUDs are also known for their convenience and discretion. There's nothing to remember before sex, no packaging to carry around, and no one else needs to know you have one. For many people, this peace of mind is a major benefit. But while IUDs offer many advantages, it's also important to consider possible side effects and risks. Some people experience cramping or discomfort during insertion, which usually lasts only a few minutes. In the days following the procedure, mild cramping or spotting may occur as the body adjusts. For hormonal IUDs, changes in menstrual bleeding are common. Some people notice lighter periods, and some stop having periods altogether, which can be a welcome change, especially for those who suffer from heavy or painful periods. On the other hand, copper IUDs can sometimes cause heavier, longer periods and more intense menstrual cramps, especially in the first few months after insertion. Like any medical device, IUDs do carry some risks, although serious complications are rare. In very rare cases, the IUD can perforate the uterine wall during insertion, or it can be expelled from the uterus, especially in the first year. There's also a small risk of infection shortly after insertion, but this risk is minimized by proper screening and sterile technique. It's important to have regular checkups and to be aware of any unusual symptoms, such as severe pain or abnormal bleeding, and to contact a healthcare provider if any concerns arise. IUDs are suitable for many people, including those who have never had children. In the past, there were misconceptions that IUDs were only for women who had already given birth, but modern research has shown that IUDs are safe and effective for most people of reproductive age, regardless of their childbearing history. However, Not everyone is a candidate for an IUD. Certain conditions, such as untreated pelvic infections, some uterine abnormalities, or unexplained vaginal bleeding, may mean that another form of contraception would be better. Cost is another factor to consider. While the upfront cost of an IUD can be higher than other forms of birth control, many insurance plans cover the full cost, and some clinics offer sliding scale pricing or financial assistance. When the cost is averaged out over several years, IUDs often end up being one of the most cost-effective contraceptive options. Beyond contraception, IUDs can have other benefits as well. Hormonal IUDs are sometimes used to treat heavy menstrual bleeding or to help manage symptoms of endometriosis. The non-hormonal copper IUD offers an additional benefit as an emergency contraceptive if inserted within 5 days after unprotected sex. Deciding whether an IUD is right for you is a personal choice that should be made in consultation with a knowledgeable healthcare provider. They can help you weigh the pros and cons, assess your health history, and discuss your reproductive goals. In summary, IUDs are a safe, effective, and long-lasting form of contraception that provide many people with the freedom to take control of their reproductive health. Whether you choose a hormonal or non-hormonal option, IUDs offer convenience, reliability, and peace of mind. As with any medical decision, being informed is key. So take the time to learn, ask questions, and make the choice that best fits your life.